Hello students, welcome to this session. Today we are going to study urine examination. So what is urine? It is formed by kidney. So kidney removes water and harmful substances from blood which body does not want, and then the mixture of water and the waste material forms the urine. So in physiology of urine formation, the important functioning unit of the kidney is nephron. So there are millions of nephrons in the kidney, and the parts of the nephron are mainly renal corpuscle containing glomerulus and Bowman's capsule. So this glomerulus means it is capillary network, and Bowman's capsule, so this capsule filters that urine portion. So the cells and high molecular weight proteins are retained, and the rest things like water and other constituents of the urine like sodium, potassium, calcium and creatinine, urea, other things are filtered in the renal tubule. And renal tubule contains proximal convoluted tubule, then loop of Henle, and distal convoluted tubule. So in proximal convoluted tubule, the urine part which is wanted substances like glucose, calcium, they are absorbed, and then loop of Henle is of two, first descending portion and then ascending portion, and then that continues with the distal convoluted tubule. So in distal convoluted tubule there is reabsorption and secretion, so formation of urea from the toxic ammonia, and then it continues with the collecting tubule, and then collecting tubule continues with the renal pelvis, and then renal pelvis continues with the ureter, and then ureter opens into the bladder, and then when the bladder is full, the urine portion is excreted through the urethra. So this is physiology of urine formation and parts of the nephron. Now we will see functions of the kidney. So in kidney, main function of the kidney is unwanted substances, they are removed. So water balance, acid base balance, electrolyte balance, then waste secretion like nitrogen, toxic substances, then synthesis of erythropoietin, this hormone is secreted from kidney, and it is mainly required for the erythropoiesis, that is RBC formation. Now let's see indication of urine examination. So urine is a common part for the investigations of any patient. So it is mainly for the detection of anatomical and functional abnormality of the kidney. So it may be in case of calculus or stone in kidney or urinary tract, so either in kidney or renal pelvis or ureter or bladder or urethra. Then infection of the kidney like glomerulonephritis, pyelonephritis, urinary tract infection or renal failure. So in that urine examination is important. Then from urine examination we can diagnose multiple diseases, like from sugar we can diagnose diabetes mellitus, from urine like doing bile salt bile pigment test we can diagnose jaundice and differentiate jaundice into different types. Then diagnosis of diabetic ketoacidosis from the urine ketone, then hormone HCG is secreted in the urine, and then diagnosis of pregnancy can be done by determination of HCG, that is human chorionic gonadotropin hormone. Then we can see parasite infection in urine microscopy, or bacterial infection by urine culture. Many toxic substances and drugs are excreted in urine, so that we can do diagnosis of drug overdoses or abuses. Then some endocrine hormones also we can do detect in urine. Then inborn errors like amino acidosis, phenylketonuria, so these are also detected in by doing urine examination. There are different types of urine specimens. So it can be single urine examination, or it can be 24 hours urine specimen. So single specimen, single urine, that is when the patient comes, that is random urine. When the patient comes, you can ask the patient to collect urine sample. Or 24 hours means you have to ask the patient to collect 24 hours urine sample. So from 8 am of one day, so 8 am till the next day, so that is 24 hours urine sample. So this 24 hours urine sample is mainly required for during 24 hours counting of calcium or proteins in nephrotic syndrome. It is very important. Now we will see collection of urine samples. So for routine examination, any random sample, whenever patient comes, you can ask the patient to give sample, that is routine examination, random sample. Then for quantitative test, it is 24 hours urine collection. So in that you have to add preservatives, or you have to keep that urine sample in a refrigerator so that you will not have that bacterial or microbial overcount, or the cells should not degenerate. Then for bacteriological examination, it should be midstream urine sample, that is middle portion of the urine. So you have to ask the patient to clean the parts with soap and water before giving sample. Then you discard few ml of the urine sample, and then take middle portion of the urine sample in a sterile container, and then discard the later portion of the urine, so that there will be minimum chances of the contamination from the skin flora or from the bladder. And then that sample is to be collected in a sterile container. Then for pregnancy test, early morning sample is preferred, because in that concentration of HCG, that is human chorionic gonadotropin hormone, is more. Then for diabetes, either it is fasting, so without taking anything, that urine sample is collected, or postprandial, that is after 2 hours of the lunch or dinner you can take the sample, that is postprandial. So for 24 hours sample, there may be chances of overgrowth of microorganisms. So to prevent that, we have to add preservatives in a urine. So they are either formaldehyde, thymol, concentrated HCl, boric acid, or you can keep that in a refrigerator. So the role of preservative is to prevent decomposition of the cells of the urine, and to prevent overgrowth of the microorganism. So in composition of urine, mainly it is urine formed as a, mainly is water, and then normally protein, sugar, ketones, bile pigments, urobilinogen, or they are absent. All the cells like epithelial cells, pus cells, red cells, they are occasional. Few crystals you can see, and other components in small quantity like urea, creatinine, sodium, potassium, calcium, chloride, or these things, or cast, they are absent. So it is a normal composition of urine. If anything is in present or in increased quantity, it is called abnormal urine.
In examination of urine, so there are physical, chemical, and microscopic examination. So first, physical examination: color, volume, appearance, odor, pH, specific gravity. Then chemical examination: sugar, protein, bile salt, bile pigment, ketone, and occult blood. And then urobilinogen is also added. Microscopic examination: cells like RBC, WBC, epithelial cells, yeast cells, bacilli, cast like granular cast, hyaline cast, RBC cast, WBC cast, crystals like triple phosphate, calcium oxalate, uric acid, cholesterol, tyrosine.
Hello students, today we will see stool examination. So what is stool? It is a excretory product of the digestive system, that is gastrointestinal system. So normally feces contain water, undigested, unabsorbed food residue, bacteria, intestinal secretions like bile, urobilinogen. Because of that it is brown in color. The consistency is soft, and color is yellowish brown due to breakdown products of bile, that is hemoglobin, and usually it is 1 to 3 times per day. So indications of examination of stool, usually for the detection of parasites like hookworm, roundworm, Entaviма histolytica, which causes amoebic dysentery, or bacterial infection like bacillary dysentery or diarrhea in enteric fever, cholera, or for the malabsorption syndrome, or to see excessive hemolysis, we can do stool urobilinogen test, or any bleeding in gastrointestinal tract, you can see by doing occult blood test. Collection of stool, for routine examination, usually stool sample collected from the whenever stool is passed in stool container, that is container contains lid, and lid with the spoon, so in that spoon you can collect that sample. For quantitative examination, 24 hours sample can be collected. In that, green vegetables to be avoided, because occult blood can come positive in green vegetables. And for cultural examination, it should be collected in sterile container. And if delay in processing, then you can add stool preservatives like polyvinyl alcohol, formalin, and merthiolate sodium fixative.
In examination of stools, so there are physical, chemical, and microscopic examination. So in physical, color, consistency, mucus, blood, volume is there. Chemical examination, pH, occult blood, and reducing substance is there. Microscopic examination, cells like pus cells, RBCs, yeast cells, and parasites like Entavium histolytica, Giardia, Enterobius trichuris, Scaris, Ankylostoma, that is hookworm, tapeworm, Hymenopus null.
Hello students, today we will see introduction of semen. So what is semen? It is fluid containing sperms produced by testes and secretions from seminal vesicle and prostate. So composition, the color of the semen is grey white, pH it is alkaline, and the portion from the testes it is sperms, usually they are 100 million per ml. From seminal vesicle it is fructose ascorbic acid, from prostate it is citric acid, cholesterol, phosphatic acid, fibrogenase, hyaluronidase. So these are the composition of the semen. And uses of semen analysis in a infertility of a patient couple married more than 6 months and they are not having any issue. So that time first investigation we do is semen analysis, and it can be used sometimes for the gonadal function test. Thank you.
Semen analysis. So there are physical, chemical, and microscopic examination. So in physical, color, appearance, viscosity, then volume and liquefaction time is there. In chemical examination, pH and fructose test is done. And in microscopic examination, sperm count, motility of the sperms, abnormal sperms, and then pus cells and RBCs.
Hope you find this session useful for your understanding and for your exams. Thank you.